Robbie LeValley, Delta County Administrator, and for this COVID pandemic, I am one of 3 of the Incident Command, along with Delta County Memorial Hospital, Jody Rober, and Delta County Public Health Director, Karen O'Brien. When we look at addressing this as a whole and as a unified effort between, again, the hospital, the public health, and the county, we are including all partners, including our municipalities in Delta County, including our emergency services, our law enforcement, our assisted living facilities, our food handling facilities. All of those are here to not only help us address, but also reduce the incidence and reduce the chance that we can continue to spread this. So we're working together in a unified effort to coordinate the activities, whether it be with the assisting the individuals in our assisted living facilities to make sure that they're not becoming a burden on our hospital, or if it is just providing that direct information to our child care facilities and doing that so again we reduce that additional risk of exposure. The unified command structure is there to 1, reduce the exposure, 1, limit the potential for increased spread, and 2, just again and again reiterate to the public what everything and every entity is doing, what every entity is doing to for the overall objectives of keeping Delta County safe, and how we are addressing that in a coordinated fashion. If we look at our specifics with assisted living, we know that that is a population that all groups have identified as one that is of higher risk. We also know that that is a group that can utilize the hospital more so than other groups in the county. So how can we set up infrastructure to say what could we put there in-house to address more of the less important calls, and not important meaning they're not critical for that individual, but perhaps it is simply a less urgent call that we could have individuals there in place to address, versus taking the chance of exposure not only to our emergency personnel with ambulance, but also our hospital. So again, it's that coordinated approach with public health and the hospital and the county to see what additional infrastructure as well as capacity we can do for assisted living facilities. The great thing about this unified effort is that coordinated messaging that our joint information folks are doing on an hourly basis, direct to that population, direct to the population that doesn't use social media. And our Joint Information Center is providing, again, that direct information through the use of volunteers that are relaying direct information, not just depending on social media, but depending on the radio, on the TV, on the print, every way that we can get that information out. And then we have such a great volunteer system here in Delta County. We're utilizing that. They're already set up when we think about the meal centers, when we think about their social activities. There is already a tremendous social network that is there in place. You know, that is their social media, is that social network, and we're utilizing that to get the correct information out and to really encourage them not only to stay put, but then allow them to stay put. We've got volunteers that are going out and getting groceries for them so they don't have to go out, setting up the businesses so that they are just adhering to certain age restrictions at certain hours. So again, we reduce that exposure. It's coordinating all of those activities that Delta County is doing in a unified command system. So when we think about the Emergency Operations Center, it is a group of individuals that are highly skilled in incidences that are out of the normal. And we have expertise right now from the Southwest Incident Command Team that is here, and they have been on several other situations. Most of the time it's natural disaster. This particular pandemic is new for them as well, but they have the expertise in logistics. They have the expertise in soliciting additional materials. They have the expertise in coordinating responses. They have the expertise to see, it looks like perhaps the hospital and the public health are duplicating effort. How do we resolve that? And they've done that very well. Delta County is extremely grateful for the expertise in the Emergency Operations Center. It includes our Chris Stewart, our emergency manager. It includes the Southwest team. It includes individuals from here in Delta County that have stepped up and said, I'd like to help, our volunteer coordinator, individuals from our clerk's office, and the list goes on, including everybody and their expertise from the Joint Information Center. It's greatly appreciated, and it's taken all of us to really address this because we are getting direction from an hourly basis that changes. When the COVID pandemic started to move across the United States, certainly Delta County knew that it would come here. We have an at-risk population. We have a virus that spreads virulently. We also watched as it started to enter Colorado. Delta County's been working on this for the last 3 to 4 weeks, and it's been in cooperation and coordination with the hospital and our public works because we knew it would be here, and taking steps to, again, minimize that exposure. And we knew it would come here, and we're not changing our protocols now that we know that it is here. We are tracking the same. Again, the consistent messaging to stay at home, to limit exposure, the social distancing, the sanitation, do not be traveling to those counties that are of higher risk. Stay here in Delta County and let's keep our cases to a minimum. When an entity such as a municipality or a county or a state declares that emergency declaration, then under statute that allows for that entity to address the emergency with not only their procurement but their policies, their ability to be flexible as far as meeting. They still adhere to posting meetings, they still adhere to the notice, but what it does allow for them to do is look at their procurement policy, increase spending limits to specifically address the pending emergency, as well as provide for that flexibility if we can use the email for a decision making, if we can use the posted meeting to expand if a decision comes up that was not known when the meeting was first noticed. It's that kind of flexibility that entity provides for when they declare an emergency. It also allows for the specific expenses for the emergency to be tracked. And Delta County, in cooperation with the health department and the hospital, are tracking every single dollar that is being spent on this emergency, so that when FEMA or Homeland Security or the federal government of some other type says, what were your expenses, we will be able to very quickly give them a summarized and detailed spreadsheet of every expense that we have incurred for potential reimbursement. Now, rarely does reimbursement come at 100%, and we know that. And that is why not only does the county, but the municipalities, they have not only the set-aside Tabor reserve funds, but they have money set aside strictly for these out-of-the-normal operations that come that will have a significant impact on Delta County. In just last week alone, our tracking expenses were $35,000. So again, that's just for the county. When we look at all of this, that's why we're keeping very detailed records. That's also another reason why an entity declares an emergency. When we think about everyone in Delta County, the response has been incredible. They have looked after their neighbor. They have reached out to see what their neighbor needed. They have looked at the information that is being put out, and they have responded. And so how does it affect our individual person in Delta County? If they've had school-age children, they have them at home. But I have seen the teachers, I have seen the community rally around everyone and start to build that community response to address the classroom. We have the school district that is saying, for those of you that may not have the best broadband, we're going to have those smaller groups. And the public health department allowed for that to happen so that we could have that increased learning. Again, it is that social distancing, it is keeping that space, it is staying at home, it is protecting that is impacting everyone in Delta County. and we need to keep continuing to stress it. That's how we're going to get through this. But we will get through this. Absolutely, we will get through this, and we will be a community that looks back and said, lessons learned, and that will be what we take away from this. But Delta County will get through this, and Delta County is doing a tremendous job. I want to thank everyone for taking care of not only themselves, but their neighbors as well. And that's what we're all about in Delta County.